Now I want to get you on something I know that you care about. We spoke about it last time, but the government's not doing the optimal job. Look at, for example, New York on equality, where white residents are being vaccinated at a higher rate than their share of the population as compared to black and Latinos there who are being vaccinated at half the rate. We talked about why fairness is essential. This is, of course, hard-hit New York, so it's an example. I also want to play a little bit of something from Bill Gates, who joined us. He's done this pandemic prep work. He brought you up, actually, Doctor, in saying both these conspiracy theories are bad, and he also spoke out about the racial injustice thus far. Take a look.
Both myself and Dr. Fauci featured in conspiracy theories. Like one says that Dr. Fauci's trying to make money off of these vaccines. It's pretty stunning that the infection rate and death rate in minorities has been over twice as high. It's partly multi-generational households. It's partly job occupation. It may have been the ability to communicate health messages in to those households. I'm stunned at that.
Your response to both points?
Well, he's absolutely 100% correct. I mean, the conspiracy theories are really very detrimental to getting a good public health measure uniformly accepted throughout the country. And that's one of the real problems we've had in this country. We live in such a divisive society that when you have public health issues become politicized and you have such diametrically opposed opinions of that, it's just really extremely unfortunate because it hinders our ability to respond. I mean, talking about it being a hoax, it's not a hoax. It's killed 430,000+ people. No, Bill Gates is not putting chips into the vaccine so that would inject into you, we could follow you around. I mean, come on, let's get serious about that. But the point that Bill made, and he articulated it very well, is that there is this disparity in equity now and has been in our society. It's something in the long range, if we get this taken care of and behind us, let us remember and not forget the disparities in health that we have to address, because it's going to take a decade-long effort to do it. But let's look at what we're facing now. The numbers you put up were quite correct. There is inequity.
Well, and I'm going to press you. I'm only jumping in to press you because we talked a lot about truth and science and the previous administration. But let's look at New York, which is, of course, run by a Democratic mayor and governor, if people are keeping track. They've relied on this internet system. 500,000 households in New York don't have internet, tends to be the poorer ones. But wealthier residents, for that and other reasons, are securing more vaccine slots. Are these ongoing problems, Doctor, where government policy can be making it even worse?
Yeah, I mean, what the numbers that you showed, Ari, are things that are disturbing. And I think when those numbers are out there, you've got to figure out a way to get around that. And what President Biden has done, he's established an equities task force. He has a person that you may have interviewed already, I don't know, Marcella Nunez-Smith, whose job is to address these. Now, you're right. There are things that are going on, even on the part of well-meaning people, that inadvertently just sometimes are the opposite of what you'd want to do.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.